Welcome to In the Green Room. I'm Kinga.
And I'm Chet, and we've got Richard co-hosting with us again.
Thank you.
Our
Well,
co-host,
it's a pleasure to
Richard
be here.
Betts.
Yes.
And we have Dr. Cyndee Garner in the house.
And the crowd goes wild.
Yay.
And we are going to be talking about so many great things and how to stay healthy and anti-aging and stem cell.
And stem cells.
So, cheers to that. Richard, what are we
Speaking
drinking?
of anti-aging, I have a lovely dry rosé, small production from Washington State. Really cool wine called Kind Stranger. Isn't that a lovely name?
I love that name.
Kind Stranger.
It seems like a cool thing to bring to a party if you just kind of met somebody.
Yeah, here.
Kind
Here's a
Stranger.
bottle of wine, Kind Stranger. I'm a kind stranger. Here's the wine. Right.
And you purchased it at Atlas Bistro.
Bistro.
Which is
Atlas Wines.
Atlas Wines.
Atlas Wines, right next to it. And this is a lovely blend of Grenache, Syrah, and
The label and like the whole design of the bottle is also
Isn't
very
it cool?
aesthetically pleasing.
Right,
Yeah,
and just on the back.
Like,
Should
that
we
would
show
look
it
really
going?
good up on the shelf in your kitchen.
Here, Ellen.
It would,
You might
yeah.
want to put it.
It's a nice
Yeah.
wine.
So Cyndee, why don't you tell us a little bit about how the future of medicine is going to be affected by stem cells? And
Oh, it's so amazing because I have been in the stem cell field for a couple of years now and just watching lots of things kind of spin out of everything that's going on. I know that there's been, some issues with getting people to understand that we're not, taking things unethically. It's actually a very much a recycled source. I mean, this is an ethically sourced tissue, and it's definitely green. Prior to this, we actually would take stem cells and everything that was in a placenta and a cord and just throw them away. So we'd look at them and discard them. And that's,
Can we dumb it down in case
that was a waste.
in case somebody's listening to this and they
Back when they were
don't
throwing it
know
away.
where this placenta is from or where the umbilical cord is from? Can you explain that?
I think those are common knowledge.
Some people don't know.
I mean, they
Okay.
probably wouldn't be able to figure out how to use a computer or watch the show if they don't know what a placenta is.
Yeah.
For
Good
fuck's
point.
Touche, Chet. I'm gonna go sit next to Chet. We're like, help me out. Like, so basically, a baby has a cord and a placenta, and those are all things that help filter the blood, make cells, and help the circulation of the baby. So in the beginning, they thought that it was kind of a storage zone, the placenta, but they've realized that it actually is a very active, metabolically active tissue, and that it plays a huge role in signaling and development and that sort of thing. They just, for a while, they didn't understand why it was so big, because it's, if you look at it, sometimes it's big or bigger than the baby.
But what's really important is after the baby's delivered,
Right.
or taken C-section, because they only take the placenta and umbilical cord after a C-section. They don't do it the other way.
Right. So I think you can use all of those cells, but you're not going to use cells from a regular vaginal birth. You're not going to use those cells on other humans because they can be contaminated with, fecal material and stuff, but they'd be perfectly fine to like study in terms of like in vivo tissue.
But so they
and that
take
sort of thing.
they take this placenta sac that the baby's been living in, and the umbilical cord that has all those vitamins, minerals, everything that's created that baby.
Correct.
And instead of throwing it in the trash,
Right, and incinerating it, because remember that's what
they are
happens
now
next.
taking it with a woman's consent
Right,
to go help save lives.
correct.
What's wrong with that?
And be used for medicine, yeah.
Sounds
wrong
good
with
to me.
So there was a
Sign me
really
up.
cool product that came out maybe a year and a half ago, and it's actually for burn victims. So
Yep.
if you've ever known anybody who got a
Yep.
really bad burn,
I've read about that.
we used to have to do skin grafting, and it's painful.
Yeah.
So they basically take the skin off of your thigh, and then they put it, let's say, on your face or your arm. Well, they now will spray. They have an aerosol spray. They spray on your arm, and it actually will grow skin so quick, like within a week or
Wow.
two. So they're using
That's
it
incredible.
Yeah.
Yeah,
Wow.
so they're
Wow.
using it for wounds or using it, you know what I mean? So if you get in a massive car accident, we don't have to go through surgery anymore to go graft skin onto you. We can
Right.
now spray this stuff on you and it starts growing.
Wow.
And
This is the whole point that we're talking about stem cells as regenerative medicine.
Exactly.
Okay.
Exactly.
Right?
And what I mean, it's so incredible. It's for somebody to be saved. Like they're injecting it into somebody's arm that has pain in their arthritis, or they're doing anti-aging. They're doing what you're talking about. What else?
It's used. It's been used for so many different things at this point. So I am a mobile stem cell, I don't know, do you want to call it stem cellologist? I don't know, make up a term
Sure,
right
sure.
on my, right here, right
Yes.
now. So I go to different houses and somebody would want stem cells maybe injected in their low back because they have degenerative disc disease, which is very common, right? We're upright, bipods, I don't know how you say that, bipods, there we go. So we have 2 legs, we walk on our body, and we end up collapsing our spine over time, right? Because the spine it gets dehydrated, and and it gets
This is our
damaged.
reminder to do yoga.
Yeah, exactly. Stretch,
Yes.
like you do some reversal stuff, right?
Yeah.
So I can go into somebody, and there's actually been MRIs where you inject into that area, and it'll show over time that it actually thickens and grows, and it starts to provide more cushioning. It hydrates. Because if you think about the blood supply, if I nick your spine or your spinal disc, there's not a lot of blood flow there. So it's hard when something doesn't have a lot of blood flow, it doesn't heal as well. So that's kind of part of the problem. So we get breakdown, but we don't have as much blood flow to the area. So it just tends to need a little bit of help. And so I can go in with, I bring my stem cells in on ice. So it's really super fun. I walk through the airport and I have to say like human tissue. I look like a normal human until I say that. Then people are thinking I have my ex's head in my basket in my little cooler. But I sometimes I tease because somebody will be like, what's in there? I'm like, well, my husband died, so I carry his head with me because I miss him, But I try to, just
Which head?
I know, right? Just a little, I like to get ahead, right? But the little cells are just packed in dry ice. They're sitting at my house at negative 80 degrees. If you came into my house and you walked in my front door, you'd see a little cooler that sits at negative 80 degrees on a battery backup. If we have a power outage, I live in a 1946 house. It's very old, so sometimes we get the monsoons take our electricity out, but they sit completely frozen. They take about 5 to 10 minutes to thaw up. I would walk in your house, Chet. I would hand them to you, and you would unthaw them in your hand for me, and I would inject them wherever you told me you wanted them injected.
And then, so does it basically just provide like a boost to the cellular health of that area, so that the stem cells basically allow all those cells to be able to heal themselves, or how does it work exactly?
So I think it works in a wide, like a little bit of a wide variety. One is that there's a lot of growth factors and different things in addition to just having these baby stem cells that are undifferentiated, so they can turn into anything. But 2, in that same plasma, you have a bunch of growth factors and signals and all this other stuff. The third thing is that people forget just me poking you with a needle stimulates your body to come rushing over there, like what happened. So you start getting like a process there, even without, because they've shown like in sham knee surgeries. So they've done studies where they've done like sham knee operations and people get pain relief. Well, that's probably because we've cut the skin, right? The moment that we cut the skin, we start signaling to the immune system to start sending over factors and start
healing that area.
Yeah, exactly. So we stimulated that area just by poking the needle there. But it's pretty remarkable. I mean, just looking at serial MRIs and things of the different things. I had a lady who was just about to go into surgery for a rotator cuff tear, and the next time I came back, I was re-injecting her husband for back pain, and she showed me she had full range of motion in her arm, didn't need surgery anymore. And she said prior to that she could barely lift it up like 30 degrees from her side.
Wow.
So I've seen some incredible things. What I'm really, really interested in, so my dad died of, I think, complications.
So most of the applications we've talked about so far are like for healing. Are there any people trying to use it basically to enhance? Like, are there athletes basically using it to try to get a advantage on the competition?
I think in some ways that will work, but I think, basically it's like you're not...
Well, because a lot of people do like HGH to try to make their healing factor
I've heard a lot of
go
athletes
faster.
using this.
Yes, so they do use it, but I think it's because if you think about there's in most sports there's a mechanism of injury and tear and wear and tear, right? Mm-hmm. And they work out so much that they don't have time to repair, so they're using it more as an accelerated, if you completely are able to repair yourself every single day, then you're not going to have an injury, right? Mm-hmm. So if you go and you end up injuring yourself little by little by little and you can't keep up with all the tears, then pretty soon you end up, injured and on the sidelines. And so that costs them money.
So
I would just think that like a lot of professional athletes would want to start using it because it sounds like
they
are.
are.
Absolutely. So there, you know, some people will use it like more preventatively. I know Tony Robbins has a really great book called Life Force. If you
Yep.
haven't had a chance to listen to
I
that, it's a
haven't.
great book. It
Talks
has
about-
lots of stuff
yeah.
about regenerative
Yeah.
medicine. The one thing that I'm starting to get more into, the reason why I like stem cells and exosomes, which are the extra cells. It's basically, in layman's terms, it would be what the stem cells poop out. It's what they create.
The waste of the cell. essentially, yeah.
Kind of, but
Yeah,
but they're all actively metabolically good for the body. So they used to just think it was waste, and they actually didn't even study it. And then at some point, somebody studied all the stuff that's outside of the cell, outside of the stem cell, and they realized it's all the stem cell creating all of this stuff, all of the signals and the growth factors and the peptides and everything else that gets put in that solution to make them all work, right? So, you know, nothing works in an isolation. It's all a balance of chemistry and, you know, and product and physiology and all that stuff. What's interesting is that stem cells and exosomes are one of the two things that enter the blood-brain barrier. So when we think about our grandmas and our grandpas having Alzheimer's disease, or you guys have been in car accidents or traumatic brain injuries or all of that stuff, really, really important. We can't go up there. We can bypass your heart if you have cardiac disease. So if you genetically make a lot of cholesterol and your heart gets blocked up, we go and we do a bypass surgery and we can restore blood flow, but we can't do that to your brain. The only thing we can do to your brain is, you know, hope that your body, by doing like neuroplastic exercises and cognitive training and that sort of thing, that we can get your brain up and functioning, right? We can teach you, after you've had a stroke and you're leaning to the right, we can teach you how to like kind of upright that and get those pathways rebuilt so you don't have as much of a deficit. But
Have you heard of any of the research right now behind like neurogenesis with like hallucinogenics? Like there's some studies they're showing that
Absolutely.
Oh,
Mushroom.
yeah,
yes.
mushrooms
Yep.
have like given some people basically it has enhanced some people's senses. Like I heard about a case recently where somebody was basically deaf before, and then after a experience on mushrooms, they were able to hear afterwards.
it's fascinating. Is it called Mystic Mushroom? There was a Netflix special.
Yeah,
Mystic
I think that's
mushrooms.
what
It was
yeah.
fantastic. It had a lot of science in it. It was
Mhm.
amazing. But that's what I'm hoping. I'm hoping that we don't have to have grandma and grandpa, you know, be out of their mind, you know, be 90 and, you know, completely baffled about what's going on. And
Yeah, there's been a lot of promise from my reading for Alzheimer's,
That's-
and other things like Parkinson's.
yes.
Some-
Yes.
With the stem.
I think like for me, I'm just more drawn to the Alzheimer's disease
Yeah,
because it's one of those things where my dad passed away from it.
Dementia,
And it was,
Alzheimer's.
and it's a very sad disease because my dad at one point, Chad, if you were buying a house, and you went and sat, people loved to sit with my dad. He was a great mentor and he had a really good sense of humor. You would have loved him. He would sit and he could calculate out. You'd be like, okay, so I'm going to buy this house. I'm going to put this much down. What will my payments be? My dad could actually calculate out pretty much to the dollar a 30-year loan in his head.
Wow.
By the time he passed away, he literally was throwing change away, throwing $1 bills away. He owned and operated a grocery store or like a kind of like a mini neighborhood market for many years, and he did all the change himself. It was like when you had just a cash box, you know what I mean, and you didn't have the register to like, you know, spit out the change for you. So my dad was really good with money, really good with numbers, and by the end of it, he like literally couldn't even do basic math. He would throw the ones away. It was just too much for him. He couldn't deal with it anymore. It was so frustrating. He was
Yeah.
so frustrated. So if I can stop that from another
But
family.
what was his age when this?
83.
When he passed?
Yeah.
So when did he get
It was
Alzheimer's?
all in the last year, and I believe, just, you know, from my basic knowledge, I wasn't scanning him and doing all that, but I believe because my dad went off aspirin, my dad went off his hypothyroid medicine because, again, he's starting to get to that age where he's like, screw it, I don't want to take all this shit, you know, It's just how it is, you know. He just was like, and he didn't think it was going to matter, and that's what I think started, you know. He was on Plavix for his heart, which is an antiplatelet, and so when you take something that thins your blood, right,
Aspirin.
and then aspirin, and then you start thickening up the blood because you're not drinking enough, pretty soon you end up with clots, and then those clots kind of hit the end of those like little tiny vessel pathways up in the brain, and those little tiny threads. I always tell people that remember that a lot of the blood vessels in your head or in the back of your eye are only the width of a hair. So if you think about that, and I have a little tiny clot, and I block that up, I can block up a lot of blood flow, you know, in your eyes
So
and the deep parts of
it's
your
interesting
brain.
we're talking about this because my dad, that lived to be 94, almost 95, he was a cardiologist, and he believed that everyone should take a baby aspirin every day, and he took one every day. And some people say you should, some people say you shouldn't. My grandma that lived to be 105 took it. How do you feel about that, Richard? Because I know you're. And how do you feel?
I don't take it.
You don't. How do you feel?
Richard does not eat aspirin.
I don't see, and I think that like some people, if you're well hydrated, alcohol and wine actually has been shown to reduce platelets. So you know you kind of already have a factor of that. But I think there's some cases if you have a history of GI bleeding, you don't want to take it, right? But
For the record, I do eat asprin.
Okay,
Yeah.
good idea.
do?
Yeah.
I do. I've had chest pain.
No.
And actually take it all the chest pain. No, but
Oh, you take it?
I do, but not every day. But I do take it. Like if I can tell if I'm dehydrated and that sort of thing, and I need some drinking. I mean, like I feel like some chest pressure. I've taken it and it's worked.
Huh.
You know.
So going back to the stem cell, how can it be injected? Okay, so if you're going to have it for your brain, how do they make that happen?
So I've when I was down in New Mexico about a month or so ago, I had given IV stem cells and IV exosomes together. So
But how do you get it in your brain?
So it just goes in the circulation. So mostly the brain will actually kick a lot of stuff out. It just doesn't open the door for it. So it will.
And how does it enter your body?
By IV.
I mean, okay, by IV, and then where do you inject it? In your arm, your leg?
Yeah, so I can start an IV on someone like in their
That's
hand
what I
and
was
their
going
arm,
to
that
ask
kind
you.
of thing. Yeah.
Injections also IV.
Yes.
Over a period of minutes or.
Right.
Yeah.
Because it's only 1 cc, and then I just
Right.
chase it with like 100 cc bolus of saline.
Yeah.
But I can, like if I'm giving it to you in your knee, or I'm giving it to you, sometimes I'll do it intermuscular. Some people don't want the IV because they have terrible veins, or they just don't like that approach. So I'll give it to you IM, and that can go. But like there's a lot of drugs, so seizure medications. And
Is there
things
like a
that.
lotion you can do to let
Like-
it just
like the-
penetrate through your skin? I
Not
don't like to
yet.
have a needle.
Not yet. But they,
Oh.
we're using a lot on aesthetics applications, and we're using it for anti-aging in the face, and we're using it with microneedles. So you microneedle it into the face. So I'll mix the exosomes with hyaluronic acid, so it's a little bit thicker,
Oh, really?
because otherwise it just runs down the face, and then you use a microneedle to push it all in.
So what
and
about
it,
dosage?
it
Good
just-
question.
Yeah, so we start off with a CC, and our CCs are estimated about 3 billion cells.
3 billion cells. Go
Yeah,
ahead.
so about 3 billion cells
Mhm.
is what they're estimated at. And so I've had people tell me, oh, well, Mexico their products have a lot more cells than ours do in the United
Really?
States. But
Always,
from what
always Mexico.
yeah, right?
Go to Mexico to get the good stuff.
Yeah, but
Right?
when you go down there, they want you there for like 3 or 4 days doing infusions and injections and all kinds of
Yeah,
stuff, and
yeah.
it's like $30,000-$40,000.
Sure.
So you're saying we can't do it here? We have to go to Mexico?
Oh no,
No.
no, absolutely not. We
Okay.
do it all. I do
Everybody
it.
knows the stuff in Mexico is way higher quality.
Listen, there are a lot. There are. I mean, if you Google right now, stem cell clinics in the valley. I don't know how many you'll find, but they're there.
Well, you want to go
And
to
I've seen-
Cyndee's practice.
Yeah,
'cause
yeah.
She is
And
the
I've seen
foremost
ads on
expert.
Facebook, and so it is a thing. But just like anything else, they're not all created equal.
No.
No.
No, and
So-
some people don't really know their product.
They don't,
Do you know what I mean? They
yeah,
don't understand
so-
where it's sourced from. They don't. You
And
know what I mean? They don't.
that's-
They
And
don't
where's
get it.
yours sourced from?
So ours actually come out of either, I believe, the lab is actually in Texas that it's created. So it's kind of like wine, right? You harvest in a certain area, but it's packaged and processed in a different place, right? So I believe the major labs that do this are all located in Texas, but the place that we source them from is in Florida. And we have found that to be a really consistent source. We've had other product where sometimes we don't get as good of results. We know if the product's crappy and it's just not performing well, and we're having to re-inject people because we will.
So is there like on the bottle, is it sealed And
Yes.
it tells you where it's from, and it's certified. And
Yes, they
you
all
know
come.
it's not just sugar water.
Correct. So they all come from FDA approved labs.
Mm.
So there are applications that are FDA approved for stem cells. So if you look at like Cancer Center of America, they do different kinds of stem cell procedures for people with cancer. So the way that it works currently for just plain stem cells is that we have to minimally process them. So that means that we can rinse them and sort them. And that's all you can basically do. That's a minimally processed product. When you get to Cancer Center of America, they take it and they they use like a method to actually create it so those stem cells are programmed to go and kill the other cancer cells.
Ah,
So they're
wow.
allowed to do that because it's a different
Now
kind
we're
of cell.
talking.
Yeah.
So, Chad, do you
Yeah.
remember we had Richard and Stacy Stevenson on the show?
Yes.
He started Cancer Treatment Centers of America.
Yeah, no, fabulous place,
Yeah.
amazing. So they.
I want to talk a little bit more about how you think it's going to affect, Alzheimer's, in the future. You think it's potentially going to cure that? Or
I think so.
Yeah.
I mean, I think
how
that
long? How long do you think it's going to be until we get to that point?
Well, so research takes on average. So the reason why I got a doctorate as a nurse practitioner was because a DNP, a doctorate of nursing practice, is a degree that takes the evidence, whatever that evidence is for whatever that we're studying, and applies it to practice. So on average, there's a continued disconnect, meaning that it takes about 10 years from something that is studied. So let's just say it's aspirin. So aspirin prevents heart attacks in patients who've already had a heart attack. Let's just say that's the piece of information. On average, for it to become mainstream, it takes 10 years for that to develop. That's crazy, right? So my degree is in getting people to make that change a little bit earlier. I want to cut it down to 1 to 2 years. Like, why would you want to wait and have 8 years go by before you figure out that you should be on aspirin?
Yeah, think of how many lives could have been, improved or saved by that.
Right.
Yeah.
The drugs that are out for Alzheimer's disease are not quite so effective, and they're very, very expensive. Some of them are costing $100,000 a year.
What? That's insane.
Yeah. So, when you think about the cost of that, but if you think about a nursing home, I'll give you an example. So when my dad got really, really sick the last month that he was alive, to keep him at home, okay, and you have to pay for this out of pocket. They don't pay for this. So they'll pay for a nursing home, which is probably about the same price, but you have to liquidate every asset that your parents own at that point. They have to have nothing in order to get the government, which is fair, right? You shouldn't have a bunch of money and then the government's paying for your final days. So just to let you, to give you a perspective, it was $500 a day to take care of my dad at home. I lived in a different state, so I couldn't physically. I can't.
What was
work.
this, Huntington Beach?
Yes.
Yeah.
Yeah. $500 a day, but that's 24-hour a day care. So you think about that. That's $250 for 12 hours. Yeah, it's not much if you think about it. It's
So how much was that a
$250.
month?
$500 a day every day for 30 days. That's $15,000.
Okay.
Yeah. So very expensive. Right?
Yeah.
So your average nursing home costs somewhere between $10,000 and up, just depending on what they're doing for them. So, stem cells don't cost $10,000 a month. So, you're already ahead if you just prevent it with some stem cells. The government would be, wise to quit blocking that and start embracing it.
Well, and stem cells are important for, healing and regenerative purposes. One thing you can do also, or that everybody should be doing to try to keep themselves healthy too, is exercising,
Yeah.
Yoga, and diet as well. You should be doing in tandem with the stem cells.
Of course.
Because it's just like anything else. It's a tool that will help you get to that result. But if you think you're just going to inject stem cells and immediately get healthy, that's probably not going to happen. You know what I mean? It probably has to be a full spectrum approach.
Yes.
You really want to be at full health. And so I don't know. My life motto is no days off. I try to work out every single day to try to stay young and healthy. So
Forever young. Oh, yeah.
I try.
I'll give you a really good yet funny story. Okay, so there's a gentleman, probably 50 years old at the time, with high blood pressure, and I think if I remember correctly, he had some symptoms of a stroke, and I think I was a hospitalist at the time, and his girlfriend was very, very worried about him, and she said he's very tired, and you need to write, because if I write a prescription, sometimes it'll be covered, and she was like, you need to write for a multivitamin. And I was like, if he wants to have more energy, he's going to need to quit smoking. And so we had this huge brawl at the bedside about how I wasn't going to write for an MVI, multivitamin, for this gentleman when he smoked. I'm like, he doesn't care enough to quit smoking. Why would I think that all that smoking, you're smoking 20 cigarettes a day, that's a pack a day, 20 cigarettes. So just think about that. That's 1 an hour for 20 hours. So if you sleep 8 hours, you're some hours you're doing 1.5 cigarettes. So you think that you're going to take a multivitamin and cancel out all of that crap that you're smoking. Good luck with that. Like, I'm not even going to bother. Like, why am I going to have the government like cover your, if you're spending your money, $3 at the time, maybe a pack of cigarettes is $3 to $5, right? It's like 10 now. So $3 to $5 a day, but you want me to write you for an MVI. I can't compute that. Like, you're willing to spend.
Yeah, it's like a long-term suicide, essentially.
Right. You're like, I don't care if I'm going to smoke myself to death, but I'm tired. Okay, well, I'm not carrying your fatigue with my multivitamin while you smoke a pack a day. Like, have a good life, sir. Like.
But this brings up an interesting discussion, because some people are so set in their ways that they're just not going to change. So, someone like that, like, all of his joy might have been coming from those cigarettes.
Of course.
And so, I don't know, it's not healthy, but you're probably not going to change that person in some instances.
Right. And so I always say this. I go back to this like very basic philosophy, right? So when we're younger, right, and we drink alcohol, it's fun. And then there's 3 stages of that. It's fun with problems, and then it's just problems. And that's when most of us, we grow up and go, hey, this is causing more problems than fun. We're on the wrong side of the scales are tipped in the wrong direction, and then we correct, right? So when you're 50 and you're having symptoms of a stroke and you're tired, maybe it's time to change something. I mean, I'm not there. I am not a health coach.
The sad part, though, is that with drinking, so many of those people are so deep in denial that they don't even acknowledge that there's a problem.
Of course.
Yeah.
It's like everything, right? It's whether it's a narcissistic behavior.
They could have drank every day for the last 5, 7, 10 years.
Right.
Well,
And they still will be in denial of having a problem.
Stem cells are probably not going to fix that.
Yeah.
You know?
It would only have to be a genuine wanting to change and improve.
Right.
That,
And that's
So
probably.
who's a good candidate for the stem cells? Who would you want to inject?
I think everybody.
Everyone.
I mean, personally, I think everybody.
Mm-hmm. So do you think it'll become mainstream?
I think like if I'm looking right now, and you have a young athlete in your life, I would be like, I think I want my kid to get, you know what I mean? Like, if I have somebody that's really progressing and I think they might go, they're like an all-stars or in a club or whatever, and they're doing something, and I think they might get a scholarship. I don't want to screw that up. I'll give them exosomes, do you know what I mean? And stem cells. I would think that you'd want to do that, because the last thing you want your kid to do is he's been, whatever activity it is for, from age, let's say 5 to age 17. So now we're on 12 years of whatever it is. It could be golfing and it's shoulders. Do you really want to run the risk at that 12-year point that it fatigues and rips and tears, and now you got scar tissue and pain, and he can't perform, and they have a scholarship, or she has a scholarship, and it's an Achilles injury or something? Like, why wouldn't you just want to prevent all that? Hyperbaric is another thing. I'm not against other treatments, but hyperbaric will also stimulate a release of a huge amount of stem cells. So, I mean, there's other ways to get it, but you know what I mean? If we're talking efficiency, our pro athletes actually have hyperbaric chambers at home, and they've gotten so cheap. You can go on Alibaba now and buy one for $3,000.
Yeah.
And how does that work? How do you?
So basically, we used to just use them for decompression chambers when people got into the oceans and came up too quick. They got the bends, that kind of stuff, where you get pressure changes that are too high for the body, and it makes people really sick. And then we started figuring out that when we took people and we put them in these chambers, their circulation was really improved. So then we started using them for wounds. And in about the 1950s, we started using them for wounds, because you basically, you go in this little chamber. It's maybe half the size of this room, 35%, 40% of this room. You basically put oxygen on. It's 100%. You put a mask on. It's 100% onward breather of oxygen. And then we zip up the tank, and then we start putting it under pressure. So we put it at about, it's about the equivalent of, I think, 52 feet under the water. And with that, it starts pushing stem cells out of your bone marrow, and it starts stimulating all this replication of stem cells. And so they've told athletes, especially the football players that get a lot of head injuries, that every day playing football is like getting hit by a car. So a lot of them have them at home. So I got introduced to one of our local football heroes. His hyperbaric chamber had broke. And so he, it's not a lot of people fix those things. It's kind of one of those, it's just not something that's very common. So there wasn't a tech and parts had to be ordered, and so he was over at our chamber getting treatments.
Oh, you have a chamber.
Best Life does, yes.
Yeah.
So
Best
one of the
Life.
one of the clinics that I'm affiliated with,
The one on 7th Street?
yes, that is
I've been there.
yes. Yeah, I know the owner quite well, Brian
Yeah.
Houston, and his lovely
So you've
wife
been there and
Tiffany.
you've done it?
Yeah.
Yeah,
Did you feel a difference?
Yeah, I felt like crap afterwards.
You did?
I did, yeah, and I didn't go back for that reason.
Interesting.
Yeah.
You heard it here first.
Interesting.
No,
So
I mean,
he didn't like the
yeah,
feeling.
Well, you know, I went there because I was, you know, really fatigued and all that stuff, and was having some issues, and it was, you know, it was. I felt okay during the procedure. You know, was in there for about an hour, I guess, 40 minutes, something like that. But afterwards, when I got home, man, I was really.
Did it make you feel like exhausted,
I
maybe?
had trouble breathing, and I was just. Not
I
feeling
remember
well.
that. I remember that.
Yeah.
So I think you have felt slightly off ever since you had your COVID shot. Is that correct?
Well, I have, yeah. You know, when I had COVID, I'd had the 2 injections, but I got COVID in July of 2021, and it was, you know, it was like a few days of flu. It wasn't any big deal. But after that, you know, my energy level went down, and I was very compromised in everything I did. Everything. Couldn't hike the way I did. Couldn't do Pilates the way I did.
They've done lots of studies now on long COVID. Long
Yeah.
COVID has a lot of inflammation, a lot of brain issues. There's a
Well,
lot
it is,
of,
and
a
I
lot of
know
inflammatory
a
brain
very
chemicals.
well-known physician who is a functional medicine physician, highly trained, and she said that COVID is a brain disease.
I agree.
And yeah, well, that's a whole other thing.
That's the thing that was so bizarre about it, is how wide of a range it had affecting people.
Yeah. So, you know, on long COVID, I think
You finally feel better. You're hiking again.
Yeah, but I'm still not back to what I was pre-COVID. But I believe that the COVID is a trigger of things already going on in your body. And
It sounds like we need to get you some stem cells.
listen, well, this is interesting because this brings up.
Did you
the
bring your
whole-
needle?
This brings
So
up
we
the
get them to
whole
bend over to the
I have
desk.
it,
Richard,
I have it
yeah.
all. I have it all at home, and I can
This
ice it
brings
and
up
be
the
over
whole
here in a hot
concept
minute.
of using
Next
stem
show.
cells prophylactically. Okay. And the reading I've done in the Tony Robbins book, in fact, the guy was talking about, you know, every 6 months I'll just go get stem cell.
So the guy from Kimura Labs, Kimura, Kimura Labs, all of their employees are given quarterly. They're giving exosomes to them quarterly, and that it's a hard product to find, by the way.
Right. So it's like getting a tune-up.
Wow.
Yes.
You know, hey man.
So every 6 months is when it should happen.
Well, no, I'm not necessarily, but she just said quarterly. You know, people are getting them quarterly, prophylactically, in other words.
Well, I always love
You
learning
know?
about new
so
ways.
it's not for a specific, you know, like for a shoulder or a thing. You know, it's
It's just to get it.
prophylactically, just to make you feel better.
Right.
Well, yeah, it sounds like a good way to enhance your body on a cellular level, but then you're going to feel the effects, you know, throughout your whole body.
And I believe that at some point that this will be available, and people will be doing it more commonly. It'll be cheaper, you know, as it gets more popular.
What does it cost
Eventually,
now?
it'll just be on GoPuff. You can just be like, jab me.
Yeah, you
man.
just walk through, like you walk through the drive-through at CVS.
Yeah.
I'll just pop out of the window and like.
That'd be nice to actually have a shot at the CVS that will, you know, do something for
Do you
you.
remember?
Yeah, that's
do you
true.
remember when they were doing the COVID testing through the drive-through?
Yeah.
Yeah, it was a scary
They
era.
would
for
they would hand you the kit and they'd be like, hey, up your nose and then swirl it around
Oh,
and then
yeah, up
up your
your
other
nose.
nostril and then they would like.
So what's the charge
that
now
was-
if somebody wants to
it's
have a stem cell?
$4,500 a unit. That's what I charge, but that's because
Really?
I'm cheaper than probably anybody else. And
So
the reason why is
$4,500 a unit is what, a little bottle?
yeah, but
And how much-
so in Scottsdale, and I've done the pricing. If you're paying for, you know, if part of what you're paying for is overhead, right? If you have a lot of employees in a beautiful posh spa or you know location, you're paying for all of that. I'm just running around in my car with a little bag of ice and cells, so I travel light, you know.
So if they get overheated, are they
They're gone.
not as
Yeah,
potent?
after 15 minutes, we don't use them. So I actually had a trip in Texas where I lost about 10 vials. So I lost something to the equivalent of about $100,000 because during COVID I couldn't find dry ice.
Oh.
And so I went home, and I actually had construction workers at my house who were working on my guest house, and I made them all take shots. Because I said, I don't know how long these have been unthawed, but it's been too long because I couldn't find ice. So I knew that they were unthawed. I have no idea if it's going to work or not. And most of them got some relief anyway. So there you go. Happy ending.
So it's very important how they're transported and how they're taken
Right.
care of.
Yeah.
Yes.
So interesting.
Remember, this is all relatively new. I mean, it's the science of it is, the research is happening a lot more than it was 20 years ago, 10 years ago even. You know, I remember back in the 60s, 70s, there was a lot of talk about stem cells, but politically,
Well, because there was an opinion that it came from like aborted babies and it
Exactly,
wasn't ethically
exactly.
sourced. And
So
it's like,
that-
what are we doing? Taking like the discarded babies from China and putting them in a
Right.
ninja blender and then like,
You know what?
just-
Let's.
Come on.
No,
let's
that was funny. It was a crazy conspiracy.
We erased the first part. because I
No,
don't
that was
want
funny. You're being you're being annoying.
Can you remember where that is?
Yeah.
I don't want that. My friends won't like that.
Okay.
So back to
so
Richard. You need stem cell. How are we gonna do this? Do you want it?
I'm gonna some stem cell.
Do you want some?
Yeah.
So would you take it IV or IM? How would you want to get that done?
IV probably.
IV.
Yeah. Well, as I am, what's that?
So we just give you like kind of like how you get a vaccine.
Oh yeah.
So you can just get it in the deltoid or
Yeah, yeah.
the hip, that kind of thing. So
Like a shot.
I think IV is the way to go.
So I think earlier when you were bringing up how they, how it was so politically, I think there was just like a lot of conspiracy and a lot of people thinking that bad things, that stem cells were collected in a way that was just not very ethical.
No,
And
right.
it's not allowed to happen. Like
Yeah,
we just
yeah.
have
Of
legislation,
course.
that just mitigates all that. So the FDA has put down very strict rules. It's just like when you get a unit of blood. So if you were in a car accident, somebody was in a car accident and they're hemorrhaging, that we busted their spleen in that car accident and they're just hemorrhaging, right? Before we can get them to the OR and get that all clipped and stabilized, we're gonna give them blood. And blood cells are, they're tested for every communicable disease, syphilis, gonorrhea, HIV, hepatitis, all of that. And we do the same thing with stem cells. They're like sent through a lab. These are FDA approved stem cells. So these stem cells are the same ones that they would buy for Cancer Centers of America or cancer treatments, because it has to be an FDA approved product.
So how much would it be if you buy them from Cancer Center?
I have no, because so now you're using it for a on label, an FDA approved, like diagnosis. Right, so if you're using it for cancer, it's actually FDA approved and it can go through your insurance as treatment, just like a chemotherapy would. So if the FDA approves something and says, hey,
so they approve it for cancer,
they do.
and not for other
So like
purposes.
leukemias and hematological
Yeah,
cancers,
Yeah.
they've
Leukemia
shown,
especially,
yes.
yeah.
So they've shown that it consistently treats and eradicates and is effective against certain types of hematological cancers.
Mhm.
The problem, what we're seeing right now is
Which
that
is
we're-
massive, because that's such evidence that it's helping your cells
course.
heal.
Exactly,
Yeah.
right? So at a cellular level, we know. What we have trouble proving now is that can we use it for knee pain and does it give it consistent results?
Like basically targeting it into a specific area.
Correct.
They're having an issue with targeting the stem cells in a specific area.
Right. So if we
Interesting.
take somebody who's, let's say, 60, 70 years old and they have a ton of arthritis, right? And they have wear and tear of the joint, they have this and that, and we give them one thing of stem cells, it's probably not going to fix it. I mean, if they're overweight and and their foot, pronates and they have terrible posture and they're loading that knee incorrectly and they're, all of the body systems that support that joint are broken down.
So it sounds like it needs to be kind of like a continuous treatment for a lot of
For
cases.
some people, yeah, because if you've had knee pain for 50 years,
So then
one
what if-
cc of stem cells isn't going to just fix 50
Right,
years of knee
exactly.
pain.
So then what are the necessary steps for it to become more widely used for insurance? Because $4,500 for treatment is really expensive for most people.
It is.
So,
The good news is they have financing for a year
yeah.
free.
Oh, nice.
Yeah.
So what is the process going to be like for it to be insurance approved for practices like yours?
So the FDA will approve something, whether it's a drug, right? So like a chemotherapy agent, when it consistently provides those results. You know what I mean? Just like the weight loss products. So you'll see stuff come in and be like, oh, there's a weight loss blockbuster drug, right? And so as long as the benefits outweigh the risk and it's a consistent benefit over a placebo, they'll usually approve it. And then once it's approved, then it gets covered by insurance.
Mhm.
But that's what needs to happen. And so some of those issues that may be occurring are, and I'll give you an example, and I'm not kidding when I say this because you guys will probably all fall off of your chairs. So I go to this house and I'm told that the guy had a very, he bought a bunch of stem cells and for back and knee pain, and it didn't work very well, and they need to be re-injected because we always say if you don't get 50% better within a year, we re-inject you. So I was sent back out there and I re-injected the gentleman, and at the time I was asking him, you know, about his experience prior, because I kind of wanted to get a feel better for, you know, what happened, what did we do, what didn't work, right? So he goes on to tell me, let's just say it was his right knee. His right knee had been replaced, it was titanium, yet the injector gave cells into the titanium knee. I'm not sure what she thought was going to happen. I'm like, are you going to regenerate some titanium? Like, I was like, I don't even know why you wasted.
He just turns into the Terminator.
It was so weird. I was like, okay, so if you think about it, if your injectors, if your injectors don't know how to handle the cells, they're not careful with them, they don't apply them correctly. Do you know what I mean? There's a lot of, you have to really know this product and understand it. You know what I mean? It's not for idiots. You have to be a skilled provider to do it.
You shouldn't have come and talked to us then.
I don't see you guys, you know, drawing them up and like injecting them into each other. Like, hey, let's try it in the mouth, you know. Like,
yeah, you've got a little book, Stem Cell for Idiots, right?
Yeah, the dummies book.
So who are the people that we could have on the show that have seen results, you've injected them, and they are like, okay, I have no pain, I'm healed,
I have a patient named Hannah who's amazing. I just injected her probably 6 weeks ago. She called me up and said she used to be a police officer and she got physically disabled on the job.
Mm-hmm.
I just gave her stem cells and she's actually thinking about going back to work.
Wow.
Like, that's...
What was her pain? What was her problem?
I believe she was back pain, if I remember correctly. Like, you know,
The most common.
Yeah, so, I mean, if you think about cops, right, they have to run, jump, climb a fence, right? I don't want to be doing all that stuff, but they do.
Some of them,
And
yeah.
so, yeah, and there's the donut eating version, right? So, you know, carbs first, running later. A little different as you age.
Let's talk about another possible application of stem cells that is really interesting, and that is the regenerative, you know, actually generating organs.
Mm-hmm. Wow.
Oh,
So like if somebody needs a new liver or something,
Yeah, this is on the horizon.
it is.
This is another
How many minutes,
part
Colin?
of stem cells.
You're at 42, so 17.
well, I've heard the
Really
application.
fascinating.
I've heard the application with this could potentially be 3D printing using stem cells. They can potentially print full organs in the future.
So we could have, I mean, if you think about it, right? We could technically have a life expectancy that could like go on forever. But you know, you got to remember, it's like, so we print you a new brain and we put it in. How do you connect all that? How do you make that all work? Like, and then does it work the same? Like if I, you know, grow Chet a beautiful, nice, you know, healthy brain and I stick it in him, like, is he still Chet? Like, is that the personality that comes out? I have no idea. I mean, we don't know it, like, what kind of personality.
It would be a
comes out.
poser.
Oh.
Fucking
This
poser,
is,
man.
I'm not Chet.
Right. So, or, you know, Chet B2, version 2, he's like all like, you know,
2.0.
yeah.
So you mean we could
2.0,
fix
right.
we could fix the idiosyncrasies?
Right, so we just go in there and, you know, do a little chin up.
Colin laughed.
Like, delete this and add that. Like more loving, less irritable. Like, you know.
Is that the near future?
Cleaner. Yeah, I'm gonna do that to my boyfriend. I'm gonna show you guys like the new version. It's gonna be like one of the. It's gonna be like a hairy woman when it gets done.
I didn't think he meant brain. I think he meant more like, you know,
Yeah.
organs that are already being transplanted, like kidneys,
Right.
liver.
Yes.
Yeah.
Yeah. No, and that would be fantastic.
So that way you wouldn't be waiting for a donor.
Of course.
So I don't understand. So you're saying they inject that organ with the stem cell?
No, you can grow these stem cells are, what's the word?
Malleable. They can become any.
There's a-
Undifferentiated.
Yeah, and so they can become anything. They can grow into any type of cell.
They could be programmed. They're
Programmed to
bots.
grow into any kind of
Should
cell.
be.
So
biological.
because
Scary. It can grow into a person?
Well, you know,
You could. So
Yeah, that's what
They-
cells do.
they're
Yes.
using DNA now to recreate things
So
that
you
been
could-
So in
extinct.
You
nine
can clone Kinga?
Well, no.
yes. So in 9
Now
months
we're
we grow
declaring
babies,
king.
right? In 9 months we grow babies.
Why would they want
So
to,
think
by
about
golly?
But that's
No,
that,
but yeah,
that's
you
something
would-
to it's something
Yeah.
to think about ethically. Do we want that? Do we want versions of people? You know what I mean? Let
Yes.
go on and on. You know, what if we were able to resurrect Hitler?
Oh my God, terrible.
Do you see what I'm saying? It's like, but we don't know. Is it not a personality issue that can that be resurrected? Like, you know what I mean? Like that would be horrific. They now have the ability to regrow your animal, your dog, for $50,000. They can clone your dog.
No.
But it's just a genetic
I don't
clone. It's
believe
not
it.
gonna be the same personality.
No, that's a
yeah,
genetic
yeah.
clone,
So it's
right.
yeah. It's
But
just,
can you imagine, like, for you see your
No, I
grandma?
don't
Can you
believe
see your
that.
grandma?
No,
She's
I don't
100
believe
years
that.
old. She
Send
still has
them
the
the
same
clones.
dog.
I don't
Do you know what I
believe
mean?
It's kind of
Scrappy,
funny, though.
version
She's had the
18.
same dog for 50 years. Just keeps
it. I don't believe it.
Send in
I-
the clones.
I
So
was
you're
actually-
saying that my dog can be made into another dog that's identical?
Identical.
There's no way.
You didn't? No, yeah, that totally
Yeah.
exists. We just have to
I know.
send in a sample of her like DNA, and they
Right.
can clone her.
Yeah.
How?
I don't know. We're not those people. Like, it's like asking, how is a house
I don't believe
built?
it.
Like, I don't know. Like, I'm not a surgeon, but yeah, it
I don't
happens.
believe it.
Like, there's
I
mad
don't believe it.
scientists. Remember
Yeah.
Pinky and the Brain? So the brain rat is like growing, you know, these stellar human beings. You better hope that nobody becomes obsessed with you and wants to like swab your cheek on a date and then all of a sudden starts growing your clones. You know, it's like a
Well,
real dog.
all they have to do is replace the chromosomes
Right.
in a cell that's already an egg cell, right? They
Right.
would have to just put the clone chromosomes in.
Right.
Yeah, so that's
So
how
what
it would
if,
be
what
done.
if you what
So
if you had a,
how do
what-
they clone you? They just
So they would take Puka's chromosomes and put them into an egg that gets fertilized, and then she'd be a clone. The
like Dolly the sheep?
Yeah.
Right.
Yeah.
So it means she'd be a half clone.
No, because we're
No.
just using the egg as like to hold all the genetic information.
yeah,
Because the egg starts replicating.
so it'd be a
It's just
clone of Puka. Yes.
like Dolly the sheep.
Oh wow, we can make 100
Yeah.
pukas.
Yeah, we could. We could have a fleet of Pukas. That'd be chaotic, though. My puppy Puka. For people that don't know.
Take over the world.
Or is it Commander? Remember Biden's dog that
Oh,
just
that-
got
Oh, the
that
dog that
poor
keeps
dog.
biting people?
They
Like,
had
we'll
to
just start
they
creating a bunch of
86 him
those.
from the White House.
Yeah.
Poor dog.
Or Commander.
But you know, you'd think that the president's dog,
You
would
would
get
think.
trained or something.
Well, yeah,
you
no,
know?
he's just biting everybody. It's like randomly.
I would pay good money to see Joe Biden try to walk that dog.
Just
He
walking
would go
the dog.
flying.
I know.
He
It's
goes,
a German
It's
Shepherd.
like
Oh,
pepper
yeah.
spray. You know.
Comical.
So back to health and wellness
Yes.
with stem cell. How do you feel that we can somebody that's already 100 years old take that and then live to be 200?
I'm sure that that's going to come about, but there's ethics to, you know what I mean? There's ethics, right? So, like, is your 200-year-old going to be able to keep up with the technology? Do you know what I mean? It's like, are they just going to stand there and, like, you know, stare at everything? 'Cause
Well,
they
it
have no
really would
idea
it
how to
fix
move
the
around.
wrinkles? Is a
Right.
big thing. 'Cause
Yeah.
I wouldn't want to live at 200 with how wrinkly I would be. It would look
Right.
like a
Your skin looks like it's sliding off
Yeah,
and, like, trying
yeah.
to exit the party.
Yeah.
There are
gross.
lots of ethical issues with all these kind of anti-aging things. When you imagine people living to 120, 150, or whatever, you know, the planet's already overpopulated.
Well, and it's wild to think
So-
that life expectancy used to be like 45. We've
Yeah.
already basically
Yeah.
doubled life
So
expectancy.
what we're
within the
looking
past,
at
like,
here is,
century.
you know, this is going to be for wealthy people. And, you know, the wealthy people are going to take advantage of these things.
And is that fair? Right? Is that fair? Like, only the wealthy people are going to get their lineage?
well, this is
like,
I
this
think-
is a dystopian kind of
But I think Elon Musk,
scenario.
just like he's tried to make cars that are more affordable, somebody like Elon Musk
He wants to
will make
upload
it-
us all into the cloud. That's what he wants to do. I'm being
Wait,
serious. He
what
like
is-
literally wants to upload consciousness.
What
That's
is
like what he's
what
working
is
on.
what is
Yeah.
that what is that show that where they had them and they were all like up in the cloud? Was it Upload? It was called Upload by
I never
on
saw
Netflix.
it, so I couldn't
Take
speak on
if
it.
you guys get a chance, it's a very interesting. So it's like people who are dead, and they're like basically it's kind of like the Matrix, right? So it's like the Matrix, and they're like communicating online, but they're not really alive. It's a very, it's kind of like your philosophy class in college, where you're like, okay, I actually biologically do things. I'm not an idea. Do you know what I mean? So it's really hard to wrap your head around that. Like when your teacher gives you a test, and they're like, at the end of philosophy, to show if you're thinking in a philosophical way, and you just write like what test, what paper.
Okay, we have 2 minutes left.
So what was the name of the show? I want to
2
watch
minutes
it.
left.
Upload. Okay, cool. I'm gonna check
Upload.
that out. Thanks for the recommendation.
You can upload it.
Is it 2 or 3?
You're at 5.
We have 5 minutes.
Oh,
Yeah,
yeah.
fine, relax.
I think you need a stem cell injection in your brain.
So
I need another one.
my last
Oh yeah, that's what you.
my
need.
last idea for everybody too
Yes.
is that a lot of people will tell me I Google, right? And that's great. But do you know that there's Google Scholar?
Oh,
Does anybody
yes,
know?
Yes.
Okay.
Yes.
So Google has a whole section of just like literally like pub health and like the NIH and all of the studies. So if you're really nerded out about stuff, either check out Life Force, because it's like an auto digest of everything regenerative, or actually go on Google Scholar. So you don't, we had one guy when I worked in endocrine, so I worked in endocrine a long time, and I remember he was like, he told one of the doctors, he gave him a Facebook post and goes, well, I say that my testosterone needs to be this because of this, and he like sent him this Facebook post, and we were all laughing like, okay, well that will like outdo my doctorate, my 20 years experience plus my doctorate degree, and
What are your
all the years of
specialties that you
studying.
I don't.
have? Saving the planet, one show at a time. And how do we find Richard Betts?
Right here. Right here.
He's right here. Right here in the green room.
Where is
And how
he?
do people find you?
So they can either call me at 714-300-5379 or cyndeecells@icloud.com. But literally, I'll just follow Kinga around. She doesn't know it.
Okay, and then Chet, do you want to talk about your music?
No, that's all right. I'm just excited for the future of stem cells and the way that they're gonna positively impact human health. So
Maybe
Yeah.
we can give you some stem cells and make you have like 10 fingers on each hand, so you can play like all kinds of
Oh.
instruments at once.
damn, that'd be nuts.
Right.
That'd be nuts.
There we go.
That'll get your marketing going.
Yeah.
Save